All right, we may still have some people who are coming in over the next few minutes, but for the sake of time, we're going to go ahead and get started tonight. So I want to start by thanking everyone for giving some of your time today to join us for this event. I have a few notes before we get started. So first of all, people of all genders are welcome and may be in this session this evening. We are also recording this session so that it can be viewed throughout the month for anyone who registers for the Race for Healing, of which this event is part of a larger series. We are in webinar format, so everyone's starting with your cameras off and your mics muted. We'll mainly be using this Q&A and the chat function tonight, so participating in this should not be any kind of invasion on your privacy or anything like that. Everyone will be confidential behind the screens, but just know that we are recording this for future use. As I mentioned, we will be using the chat line tonight to talk with one another. If you're comfortable, go ahead and enter your name and where you're joining us from and maybe your interest in this presentation tonight in the chat box. You may want to also make sure that you're messaging all attendees and not all panelists, which I believe is the default setting. So make sure you're sending your message to the right person, and we'd love to hear who you are and what you are interested in learning tonight. If you do have any questions in particular that you'd like to submit to the presenters throughout the event, please use the Q&A function for questions specifically, and we'll do our best to either send you a reply or to answer that question live. And we do have some wonderful person on the back end doing our tech tonight. You'll find her under Julia Tech Support as someone that you can message if you need to. If you are experiencing any issues with the technical features, please feel free to send a question specifically to Julia at Tech Support. And I just saw someone raise their hand too, that I don't know if you meant to raise your hand or if you're kind of testing the features, but certainly if you have a question tonight that you would prefer to ask unmuted, raising your hand is a good way to do that. We do have a lot of content to get through, so we may not be able to do that. So I do suggest using the Q&A if possible, but if you would like to ask your question live, you may raise your hand and we'll answer you on that one way or another. So my name is Melissa Henshin. I am the Manager of Outreach and Community Engagement here at Wings. We are honored and grateful that you're choosing to spend your time with us for this afternoon's special virtual session about health equity and CSA survivors. Because of the importance of this topic and our partnership with CICASA and Illuminate, we have made this session available for anyone to join and not just those who are participating in Wings' 2020 Race for Healing series of events. Our series of events for this month has a special theme this year, which is It's About Time. It is a series of learning and holistic healing activities that we've chosen for a few different reasons. First, we believe as a culture that it's about time, that we recognize the needs of adult survivors of childhood sexual abuse because this issue affects so many people in our culture, 1 in 5 adults. Second, to overcome the silencing and denial affecting survivors around this issue, it will take each and every one of us dedicating our most precious resource, our time, to learn about, speak about, support, and help with the healing of CSA survivors. The more time that we all spend supporting survivors and this issue, the more time survivors can spend building healthy and thriving lives. We also know that this is a difficult year with physical distancing. All of us may be experiencing extra stress in our lives, and this can be hard for those especially impacted by CSA, as well as those who are not having this trauma in their lives on a day-to-day basis. The good news is these types of healing and holistic activities that help soothe, support, and strengthen healing and resilience during trauma recovery are actually beneficial for all of us when we're navigating our life, and especially when we're experiencing extra stresses like those happening in the world around us. The healing journey from CSA trauma has a lot of wisdom to teach us about healing in the world. So that's why we've created these virtual sessions, focused on aspects of holistic healing that follow our theme, It's About Time. Because healing is about the time that we spend dedicated to many of these foundational practices. It's also why we're encouraging those who are participating in our Race for Healing online to track their minutes instead of miles or steps, which are also available, but we're focusing on the minutes. This session in particular is being offered to people whether or not you are signed up for the Race for Healing. And we have a lot of you who have joined us in that way today, and we thank you for that. If you do decide that you would like to register for the Race for Healing, but you haven't yet, just know that it's not too late to join us. We'll talk more at the end of the call about how to register and give you information about how to access all of the events this month, even those that have passed us, about healing, movement, and how nutrition affect the body, and so much more. You will also receive a race t-shirt if you choose. And if you or someone, a survivor or loved one that you're working with, is interested in joining us as well, we obviously would love to welcome you into this event. Know that it's not only is it not too late, but scholarships are available, generously sponsored by Lisa Levin Apple in honor of Marilyn Vanderburg. And so we do not want finances to be a barrier for anyone to be able to participate, especially at this point in the month. So, to the good stuff tonight, I would like to welcome you to our 7th virtual session in this year's Race for Healing event. It's about health equity. Whether you're a survivor of childhood sexual abuse, the loved one of a survivor, a healing professional, or a new friend or ally to this cause, we thank you for tuning into this presentation, and we hope you will get so much out of its wonderful content. Now, I'm going to bring all of our co-presenters onto screen for this session. Wonderful. Welcome, everyone. Now, we are about to do a screen share. What I'd like to share with you before I do that is that if you want to keep the ASL interpreter on your screen while we're sharing ours, but you're not seeing all 3 of the presenters and the interpreter, what you'll need to do is after I screen share, and these instructions will go into the chat as well, you'll see a selection at the top of your Zoom called View Options. Click on that and you should see an option called Side by Side. You'll want to make sure that one is what's checked. If this doesn't bring up all of the presenters and the interpreter onto your screen, you can send a message to Julia at tech support. And I am going to turn it over.
Well, thank you, Melissa, and thank you everyone who's joining. It's just wonderful to see the names of everyone in the chat line and the places that you're joining from across Colorado and many other states. Hi to our friends in Maine and I think Arkansas, New Mexico. It is heartwarming to me to feel connected to all of you tuning into this important conversation. We are thrilled here at Wings to be able to talk about this topic of It's About Health Equity, exploring the roots of power and intersections of oppression affecting childhood sexual abuse survivors as part of the Race for Healing that Melissa talked about, which is a month-long virtual race for us this year during Childhood Sexual Abuse Survivor Awareness Month, or CSASAM, which we've been celebrating here in Colorado for several years to try to bring more awareness and attention to the needs of adult survivors. And certainly we felt like this is one of the most important sessions that we should be and could offer this month. And the only way that we could do that was in partnership. So I really want to thank the Colorado Coalition Against Sexual Assault and Illuminate Colorado and my co-presenters joining me today for making this possible, and would really like to start out and ask them to start by introducing themselves. And as we do so, we're going to be sharing our social locations, which really describes aspects of our identities that let you know the places from which we're speaking as we share the perspectives that we're going to be sharing with you today.
Great, so I'll get started. Hello, my name is Maria Mendez. I am with CCASA, the Colorado Coalition. My pronouns are she, her, hers. And just kind of my social location, I'm a cisgender heterosexual Latina. I'm first generation from Mexico, grew up in California in a predominantly Latinx community. That was a big change for me moving to Colorado, where my Latinx identity has become more salient to me. I'm also white passing, So I do have a lot of passing privilege in a lot of different ways, both in my skin color and in my accent and in my speech in ways that maybe my mother doesn't, right? So that's just kind of where I'm coming from. That's where I come to this work from. I do have a lot to learn as well. And I also have a lot to share in terms of lived experience from being from a marginalized background. And I'm excited to be here with Anne, with Jenny, and with all of you.
Super, thank you, Maria. My name is Ann Auld. I'm the Director of Education with Illuminate Colorado, and we're a statewide nonprofit that works through advocacy, education, and family support to strengthen families and to ultimately reduce child abuse. My pronouns are she, her, hers. I am coming to you from a place of a cisgender straight woman. I grew up in Denver, and although I attended Manual High School, those of you who are Denver natives may be familiar with Manual. It was during busing, and so it was a very interesting situation to be a part of, to kind of have this essentially forced bringing of people together. And yet when we got to the school as kind of the white neighborhood that was moved into a predominantly African-American neighborhood, we were tracked. And so although we were in the same building as folks from the community, we weren't in classes with them. And it was something that actually impacted me throughout my life, and certainly impacted my decisions on where it was that I lived and where my children went to school. I have a long history of working in prevention, began my career teaching, and then also in child welfare, and at a certain point realized that I wanted to move upstream and to ensure that families and communities had the support that they needed to prevent children from being abused and neglected. And so as my time with Illuminate, been there since the merger of a couple of other small nonprofits, we've really been able to do a lot of work across Colorado in that prevention realm. But that's where I sit, is in prevention.
Thank you, Anne and Maria. And again, I'm Jenny Stith. I'm the Executive Director of Wings, and we are a nonprofit that supports adults who were sexually abused as children. We work with folks who are 18 and over, and our primary program is a support group program for survivors. We also have groups for loved ones of survivors, primarily here in Colorado right now. And then we provide phone consultations, referrals to survivors who contact us from all states and often from other countries. And we do our best to provide referrals in the best ways that we can. And then we do training and education, and we do advocacy, which for us, because of the size of our organization, is really grassroots advocating for the needs of adult survivors as an underserved population. And we'd like to do so much more as we're able to be more successful in that. And that's one of the reasons we want to open up the conversation today. We've combined some information from the different groups that are coming together, and really look forward to hearing the perspectives that you all will be sharing as you hear this. And in terms of me personally, I am a white, straight, cisgender woman, and I'm from Kentucky, and I've been in Colorado 7 years. And I really came to Wings and to Colorado to be part of this mission because of my own challenges as a survivor of childhood sexual abuse, of getting help when I needed it 10, 12 years ago. And at that time, I was working in healthcare for a children's hospital that was part of a large health system with many adult hospitals as well, and was also a young adult leader in the Catholic Church, was fairly well connected in an urban city, although it was a rural state, and had a lot of privilege. Although again, grew up in a rural community, grew up on a farm. But even at that time, 10 years ago, I had such challenges getting support for this. So what I bring is some knowledge around the systems that I've tried to navigate personally. And then through the work that I'm honored to be involved with at Wings, in the work that we try to do for survivors, we've been seeing a lot of challenges that survivors are navigating. So we want to talk about some of those today. But just as Maria said, I have a lot to learn, especially in the area of anti-oppression work. Although this isn't new for me, I feel like there are deeper levels that I'm really want to be accountable to for myself, and then for Wings as an as an organization, we really want to walk the walk of being anti-racist and disembodying in all ways white supremacy as an organization. So that's why we're thrilled to be learning from our colleagues, and we have pulled together a lot of information from different sources. And I'm realizing as I look at the clock that there's no way we're going to cover all of this information. As a note, I tend to be a visual learner, so I wanted to share a lot of visual representations in case that's interesting for other folks. But we've also tried to include the sources where we're getting everything, and we will make available a PDF version of the presentation to anyone who's interested afterwards. So if we don't go as deeply into a topic as you would like, one, I apologize, and I can say we're just probably not going to be able to do that. But we do hope that you'll be able to do some more study and dialogue on your own. And we do have a list of resources on our website to provide some additional learning opportunities. So anytime we talk about childhood sexual abuse and trauma, obviously we want to talk about self-care. We know this is a difficult topic. Some of us may have direct lived experience and have experiences as children, or again, indirect in terms of a loved one, a survivor, or certainly a lot of professionals on the call who work with survivors every day. Really want to make sure that you do what you need to do to take care of yourself during this conversation. And we have a resource to share in that way on our resource page. Just scroll to the bottom of that link, and this image is there with a link to grounding suggestions on how to ground. And then if it's just helpful to have a healing image to look at, this is available at that place with the mantra that you can use. And you can always step away from this presentation. It will be recorded, and you can access it another time. We want to invite you, as we get started, to be present with how you're feeling today, and however you're feeling is okay. And this is something that we just, want to call your attention to.
Great, so thanks for setting that up for us, Jenny. I do want to have a kind of an additional framing and context for us as we talk about anti-oppression. We want to center this conversation in this particular context of the fact that we inherited and we benefit from a system of oppression that we're just now, and we would argue, particularly in this moment, with the context of Black Lives Matter, with just a variety of different things that are happening in our world around anti-oppression, that we're really learning to understand them. They're coming to the forefront, and we're learning to dismantle them, right? So this is our context. It has to be in everything that we do, because all oppression is connected. We can't end sexual violence of any form, including child sexual abuse, without looking at racism and sexism and ageism and any of the other isms. Again, they're all interconnected. With that, we all experience some form of privilege, right? So I mentioned in my check-in that I have passing privilege in a lot of ways, right? But that doesn't mean that I don't experience oppression with other sections of my identity, right? So it's important for us to know where those intersections are for us, where we do wield some of that power, and where we may be disempowered in a lot of ways. And oppression is a form of violence, right? A lot of times, often just the act of oppression is violence, but it can also be manifested in physical ways. When we talk about racism, sexism, when we talk about sexual violence, sexualized violence particularly, right? And as long as there's been oppression, there's been a history of people working for liberation towards that, right? Right now in this moment, it's more broad that people are starting to acknowledge it, starting to see it, but there has always been a group of people, particularly the most marginalized, who have been fighting for rights and liberation for all. And we hope that by the end of this conversation today, that we can see where we have those points of power to respond in these very new ways in order to be anti-oppressive and to be able to support survivors as well as hope that there isn't a survivor to begin with. So yeah, I'll go ahead and turn it over back to Jenny.
Thank you, Maria. And I'm so glad you said that, because obviously we definitely want to create a world where this does not happen. And I hope that we'll see some ways to think about doing that through our time together, and as much as we talk about strategies for healing as well. Want to provide this extra reminder to promote some resilience. And Jean McAllister is on the call. She's a wonderful clinician and has taught our organization a lot and is continuing to teach us about being a trauma-informed organization. And she's also wonderful in bringing poetry into the meetings that we have around bringing this work into the world. And this is directly from her training, so I hope that's okay, Jean. But I just think it's a beautiful reminder. This is called protection. Protection has learned from the butterflies how to make a chrysalis for the changing human heart. And as we go through this presentation, we want to remind ourselves that it's okay to be in that process of change, and that it's really a sign of strength to be able to do so. And so as we get into the content, we're going to remind you every so often of that ability to be resilient. And we wanted to just ground that with this offering.
And as we move into the remainder of the presentation, I wanted to take some time to look at agreements to make sure that we're creating a safe and nurturing space. And one of the things that we really need to start with is that staying open and curious, and really assuming that everyone's coming from a place of good intention. I would ask that you allow yourself to be challenged and possibly uncomfortable. Talking about child sexual abuse just in general, it can be uncomfortable, but when you add this layer of oppression and the discussions that we're going to have, it can be even more complicated. And so just allow yourself to be challenged. Value each other's courage to share in that chat box. That is something that there are no wrong answers, there are no right questions or wrong questions, but being sure that we value and respect that space as a safe place to be able to ask some of those questions or make comments. And support each other in taking risks and making mistakes. And just kind of keeping in time, thinking about time, that if you have additional agreements that you think that we should have for that, I would love for folks to add those into the comment box, and we'll keep an eye on those and ensure that those are also agreements that we are in line with as we move through the presentation. And just want to remind everyone that throughout this, we're looking at our resilience as our capacity for change. And so thinking about that butterfly and that movement as we move through the presentation.
Great. So this is called health equity, right? The term health equity is in the title. So we wanted to set a foundation for what equity is before going into that. Historically, we use the term equality as our goal. But as you can see in this image, it discusses how everyone receives the same thing. It is equal. You see each of them get one box, but it doesn't really make a difference, right? The person who is needing that support can still not see over the fence. Equity extends it so that not everyone receives the same thing, but everyone receives the support that they need in order to be on equal footing, right? When we talk about liberation, we reimagine what supports are even needed. We remove the barriers themselves so that folks have what they need from the beginning without needing any additional support, right? We have since, from this image, moved towards this understanding that it's not just about the individual themselves. Right here, it's about their height. But we've moved towards an understanding of the fact that the world is built and systems are built and they work in order to be unequal, right? Or unequitable. And so we think about an uneven ground as it is, because then it doesn't focus on an individual's identity, it focuses on the systems instead, right? So instead of this fence, the barrier is the ground itself, regardless of how tall someone is, that we're no longer on an equal or an equitable playing field, right? With that, without understanding of equity and that next step Jenny's going to talk to us a little bit of what that means for health equity.
Thank you, Maria. And yeah, so health equity is really the idea that we should all have the same advantages to be our fullest, healthiest selves. And that really being aware of anything that is getting in the way of that is a primary way that we can support health equity. But it's important to adopt the mindset that we all really deserve to have that ability at the same levels. And again, just to move quickly through these slides, ways that people talk about achieving health equity are through social determinants of health. On the next slide. And really, these are aspects of our lives that contribute to our quality of life. And this is a really simple slide to tell you what some of the social determinants of health are. So the environments in which we grow up that shape our childhood experiences are actually a big part of that. And we'll get more into that in a bit. Do we have safe housing? Do we have access to quality education and to other social supports that we might need in our lives? What is the household income that we might have supporting us? Do we have a good job? What are our neighborhoods and communities like? And do we have access to the health services that we need? So some of these are transparent, that kind of makes sense to us, but this also includes things like quality of the air around us, themes of racism and oppression that we're going to get into. These types of things can actually affect our health. And for some folks, you might think, well, yeah, that totally makes sense. But for others, maybe it hasn't, you haven't encountered an idea like this, that these are just, yeah, this is just part of life. And, however I'm experiencing this right now, it's just kind of the way things are. That makes sense. And I think there was a time in my life that's what I thought too. But really, we want to unpack that a lot of these social determinants of health are socially created. They're created by the systems that we're all a part of. And they can also, these on the slide can feel kind of external. These are things that are happening outside of us in the world. But on the next slide, and doing research for this presentation, I found this example of social determinants of health. And it's based out of Canada. And it really centers the experiences of First Nations people or Aboriginal individuals. And what I love about this is it centers that personal experience of these things at the mind, body, spirit, and emotional level, with that core sense of self being at the center. And if you are someone who's tuned into our other offerings throughout the month, you know that we've been talking a lot about mind, body, spirit, because in healing from childhood sexual abuse trauma, we all have to, or are invited to really heal those components of ourselves. But if we could prioritize that from the beginning, such that trauma doesn't happen, then that's what we'd like to do. And so what I love about this image is it still has the same social determinants of health that I just mentioned wrapped around that person at the individual level. It brings in the extended family, brings in their ancestral background. And that's really important too. We don't just show up in the world without, parents and without grandparents and without great-grandparents. And so the conditions that they experience have a lot to do to shape the ones that we then inherit. So we're going to talk more about that as well, but I love that model. That moves us into the next slide on adverse childhood experiences. Remember, one of the social determinants of health is childhood experiences. And this research is through Kaiser Permanente and the CDC around various types of childhood traumas that, again, occur in our youngest years that go on to shape our health and well-being throughout our lives. And when I left healthcare in 2009, I actually hadn't heard about the ACE study. I was waking up to this in my own life, but I do think this is emerging in a lot of different spaces right now. And the pyramid on the left just shows how, again, the trauma happens in our earliest years. It builds upon these additional challenges throughout our lives. It absolutely can lead to negative health outcomes, a lot of health challenges and even early death, which is the sad, awful thing about these realities. Yet with greater awareness, we can start to then think about how do we prevent them and how do we treat them. But what I love about this chart is it brings in the pyramid on the right, which adds those foundational additional layers of that ancestral piece and that social environment piece. And I just think that's so important. And this is out of the Rise Center in California that really realized these components were so important to the youth that they were working with. And so want to offer this for the additional parts of our conversation. And on the next slide, this is, again, I don't have time to fully go into this from a clinical perspective, and I'm not a clinician anyway, but as a survivor, when I saw this, I thought, what a great representation of why it matters if a child is experiencing adverse childhood experiences or not, because at a very high level, all parts of the brain are so important, but there are higher brain functions and lower brain functions, and the lower brain functions are all about survival, fight or flight. So if someone, and it's, it's designed to keep us out of danger, and those are, cues for us to do something to try to escape that danger. In a typical child development on the left, hopefully a child is supported, they're safe, they've got their needs met, they've got, safe housing and good food to eat, and, caregivers that are able to nurture, and, they're not being harmed or abused. Their brain is able to move into that higher brain functioning because they're not in constant fight or flight mode. But for children that have experienced abuse, and specifically childhood sexual abuse, which we know often goes along with neglect and other types of adverse childhood experiences, they can be in constant survival mode. And so you can see that their brain does not have the same ability at that time to move into those higher brain functions. And again, as a survivor, I find that really helpful for me to understand. And then for us to think about, well, how do we keep more people from our earliest years throughout our lives to be able to not be in that crisis or survival mode? Because what the ACE study has really proven on the next slide is specific to childhood sexual abuse survivors, because the brain is connected to the central nervous system, to all other parts of the body, that stress actually impacts us throughout our whole, again, mind, body, spirit container. And so that shows up in symptoms like obesity, depression, anxiety, post-traumatic stress disorder, or post-traumatic stress injury, because we do think these things can be healed. I want to say that right now. We'll reinforce that in a moment. But, sleep problems, eating disorders, substance use and abuse, re-victimization, and all of that has impact on survivors' lives in terms of economically, and going to medical providers to treat these symptoms. And again, with this research and with what a lot of you on the call, in this field know, these are symptoms of dis-ease. They're often not the diseases themselves. The body is in dis-ease for a reason. And so really connecting those dots, I feel like, is a very emergent, awakening really for our culture. And on the next slide again, it's easy when we talk about trauma, we talk about, gosh, the damage that is done in childhood. It's so easy to feel hopeless about that. But the good news is that we really are designed for wholeness, and remembering that resilience is our capacity for change. That is true on that mind, body, spirit level, that the psyche, the spirit, and the soul can renew themselves. And this is just an image to give you that reminder that there is a ton of hope and a ton of solutions to bring to this conversation. So kind of want to pause there just to remind you that if you have a question, to go ahead and send that in through the Q&A box. And if anything's coming up for you that you want to share as like an insight or something related to what we're talking about, you're welcome to share that in the chat. We just may or may not have time to talk about that. And as we transition into the next slide, I just really, again, the point of this is to think about what factors contribute to childhood sexual abuse so that we can understand how to support healing for survivors and also how to prevent childhood sexual abuse from happening in the first place.
Yeah, so, Jenny, you talked a little bit about that historical trauma and that those bottom two pieces in that pyramid, right? And I did put in the chat box, when you compound oppression as a day in and day out lived in experience, that is something that almost becomes one of those ACEs, right? And it's important for us to have this foundation of what is oppression, how are we defining it so that we are on the same page. And oppression, as you can see here, it's something that is a systemic and pervasive, and it's a mistreatment of certain groups of individuals, making one group disadvantaged while the other one privileged, right? It's this inherent imbalance of power in the way that these systems are created, right? We often hear the phrase, oh, wow, our systems are broken. They're not. They are working in the way that they were built to work, right? Because the way that they were built were to advantage some folks over others. And this occurs on several levels, as you can see on the slide, right? It happens at an interpersonal, at a cultural, institutional, and structural levels. And we'll talk about these in terms of the 4 I's of oppression later. But essentially these points where exploitation or benefit happen, those lie within our social identity. So again, how we talked about at the beginning, what our intersecting identities were of, I mentioned passing privilege, but at the same time, I'm still, a first generation immigrant, right? So thinking about some of those things as well. If you go on to the next slide, please. These identities, they intersect in this way, right? So we have these socially constructed identities where we place values on each of these categories, right? So for age, the privileged identity is someone who's kind of maybe middle age, generally between maybe your 25s through 65. Right? Some conversations around anti-oppression even put it down to 18. And also I would posit that it is that middle age, right? Because when you're a young adult, there's still a lot of disenfranchisement that happens, right? When you're thinking about sexual orientation, individuals who are part of the LGBTQ plus community or communities, right, are the marginalized communities, whereas heterosexual individuals are the privileged group. We have race, where white individuals are privileged, and basically anyone else who is not white is in an underprivileged or marginalized identity group. Gender, where we have, I think all 3 of us mentioned being cisgender, right? What that means is that our biological sex at birth matches our gender identity, right? And so someone who is cisgender is the privileged group, right? We also have men, or male and female, man and woman, where man is the privileged group. And then we have these other things around this that may be a little bit more difficult to see, but you have education, education status, socioeconomic status, that really impact the way that we walk through the world and the way the world perceives us, right? And so this is important to note, particularly because of the way that it impacts health equity and our access to health in many of the ways that Jenny was talking about earlier, right? So if we go to the next slide, these are just some examples. So some of those intersecting points, right? We can see how someone who is, for example, let's see, sorry, it's a little small on my screen. Someone who is married, who is HIV positive and is lower middle class might have a completely different experience seeking services or in the way that they experience gender-based violence than someone who is older, unstably housed, and a transgender individual. Right? So it's important for us to know, particularly, and even for CSA survivors as adults and as children, how this impacts the experience, the access to different things, the way that their caregivers might respond to them, their caregivers' identities might have an impact on how they are able to receive services or access services, or how they might be treated. So that's very important to note. We also have, in the next slide, we had a video, and the link is going to be put in the chat box. We, unfortunately for time, won't be able to share that with you now, but it's a really great understanding and introduction on this intergenerational trauma that Jenny was talking about earlier, right? Of the impact of how, even though I may not have experienced something, or Jenny may not have experienced, or Anne, but it's something that our ancestors experienced, we can still exhibit some of those signs and symptoms of those traumas. And it compounds that trauma and impacts the healing journey for individuals depending on their identity. So we're gonna go ahead and breeze through that. And I'll turn it back over to Jenny to tell us a little bit more about some direct impacts on specific groups.
Thank you, Maria. And it is a wonderful video. It's actually from a foundation in Australia speaking to intergenerational trauma and colonization of First Nations individuals there. And it's so important for us here in our country to know that we have that type of historical trauma due to colonization. And I don't have time to fully go into this again, but what I want to say is, you know, growing up from the social location that I told you about, I really wasn't aware of this at the heart level. This was what I learned when I went back to school at 30 to get a women and gender studies degree, because I was waking up to this world, and I was shocked that I didn't know these things. And so during colonization, you know, children were taken from their homes and put into boarding schools and Americanized, and experienced horrific direct abuse, along with the results of that, losing their identity, losing that direct connection with their family, sense of community, the loss of their language, and then all of the impacts that go along with childhood sexual abuse, you know, that any child would experience, were compounded by these additional abuses. And so we can see a direct connection with many of the challenges that Indigenous people experience today from those generations of passed down trauma, starting from these earliest experiences. And we just really need to be aware of that this is one of the types of abuses that our country was founded on. And another example, of course, is in the Black community. And we want to, you know, name that in the next slide. Survivors who are Black women experienced additional challenges due to sexual victimization that are different than what white women may experience. This statistic that, you know, 40 to 60% of Black women are subjected to coercive sexual acts by age 18. And so many don't report for many of the same reasons that all survivors don't report, and yet additional ones that truly I wasn't even really aware of, in terms of, you know, needing to protect Black men in their community because of the challenges that come along with being Black in our culture, which Maria will talk more about in a moment. So having to be you know, extra careful about reporting because of the systems that have been set up to really disempower the Black community in general is something that, you know, a lot of folks don't have to worry about. So really being mindful of the ways that historical trauma has really impacted so many members of the BIPOC community. And Maria, can you share more about how that shows up today?
Yeah, absolutely. So particularly as Jenny was talking about with Black women and the special consideration when working with Black women, whether they're CSA survivors or survivors of SV as an adult, reporting or seeking services can be is not an option for a lot of folks, right? Because of, again, this context that we're in with Black Lives Matter, where there's the mass incarceration, murders of Black lives, and blatant police brutality against a very specific group of people, which are Black men, as well as Black women, right? There's this idea that, or the sense, because of the mistreatment in these larger systems, that folks need to stick together, right? I'm not going to be the reason why there's going to be another one of my community who's going to be incarcerated, or another one of my community who's going to be murdered, right? And so that's very, very prominent in the Black community and also other marginalized communities, right? So thinking about Latinx community, often in ways not to the level that we're seeing now with the Black community, right? But these are all special considerations to take when working with marginalized populations, right? So here we see that also playing out in terms of, it's since the Civil War ended, or since the Civil War, 8 generations of Black children were born, grew up, toiled, and died as the property of white adults and children. So building wealth was difficult, right? So there's this overabundance of folks living in poverty because of this intergenerational trauma and historical oppression. Building wealth wasn't a possibility. It was denied through slavery, right? And so poverty, we can see that really playing out with health equity, and why this conversation is centered around health equity, because of all of these symptoms that you see, all of this family stress, child abuse and neglect, substance abuse, mental health challenges, right? So you see some of the highest rates in marginalized populations, particularly Indigenous Native Americans, right? So we're also seeing that now with an increase in the pandemic for folks generally. And so this is where that health equity piece comes in, right? Folks aren't having access. They don't have the access to be able to essentially live up to the American dream that we are told is a possibility, because the systems that we talked about that are not broken, that are built this way, are really preventing for these communities particularly to build wealth, to build wellness in that space. So, Jenny?
Yes, thank you. And I see in the chat a call out to remember that childhood sexual abuse specifically and sexual violence more broadly is often goes right along with colonization, that is a direct way that violence was enacted and power was enacted. And I appreciate that point, because that's what we want. We wanted to connect those dots today. We need to know this as survivors and as professionals in the world, and as people working to see the systems and what has been left out of the stories that we've been taught, to really transform those systems and lift up the voices of everyone who's been experienced in these ways. I really just wanted to, again, show graphically what this turns into in terms of someone dealing with these levels of oppression, that this is the health gradient, and it's a way to measure the distance between someone's income and their health. And so it's no surprise that those who have higher income tend to be healthier, and those who, again, are experiencing health challenges, which you could say this bolder representation could be childhood sexual abuse, additional victimizations on top of that, all the issues that come along with that. The more oppression someone's experienced, the steeper the hill that they're trying to climb with that boulder. And they're left essentially to deal with that as an individual. And often if you think about the types of stereotypes that then get said and enacted on people is, oh, they're not, somehow they're blamed for the situation that they're in, that they're dealing with. And there's no recognition that they've been set up to be in this position. And again, as a white woman who has had my own version of that, I can't imagine what it's like for others who have not had even the level of privilege that I've had. So again, really wanted to make sure people understand that connection and remind us that resilience is our capacity to change. And I love this quote by Tarana Burke. People need hope and inspiration desperately, but hope and inspiration are sustained by work. And I really want to call out that I don't think she means by work, pushing that boulder up the hill harder. That is not what she's talking about. She's talking about removing the boulder and removing the hill and being people who are willing to do that type of work. I hope that's what she's meant. I don't mean to speak for her, but that is the work that we want to be part of.
And that is why this lens, again, we're gonna, keep coming back to this. That's why this lens is so important, right? Where most of you are probably familiar with the violence continuum or the sexual violence continuum that looks like a pyramid, or it looks like a scale. But there's this reimagining of a continuum so that we can see that the center of this is oppression, right? As we've been talking about this afternoon. Oppression and all of the isms that surround it lead to the ways, the tools that are used in order to continue that oppression. And they're named differently. They're named sexism, they're named CSA, they're named ableism, right? But those all stem from someone being disadvantaged, someone being marginalized, right? And so we just kind of wanted to reiterate that as we continue to have this conversation. So with that, oppression, because it's so centered and it must be centered in the work that we do, wanted to talk a little bit more about these level of oppressions that we set up a little while ago. So we like to talk about this in terms of pillars that uphold oppression. So these 4 I's are these 4 pillars that uphold oppression, right? So hence we have to address all of them in order to remove oppression. We can target one of them and it will help weaken the others, but we do need to target all of them, right? And so there's a video link that we're going to be putting into the chat box. Thanks, Julia. That when you have time, that's a really great kind of overview of these 4 I's of oppression. But essentially, ideological is just the ideas, the narratives that we have about a topic, a system, a thing, right? So for example, for CSA, it might be this idea that children, similar to women, should be seen and not heard, right? Or maybe they're just little adults, right? That impacts the way that we interact with children, right? Particularly if they're seen and not heard, it leads to the dynamics of not paying attention to what they say, and it reduces their credibility, right? Also, it could be this idea that particularly Black and brown girls are being hypersexualized, right? This idea that certain girls, certain communities are older than they are, that is part of this ideological oppression, right? Institutional oppression then would be something where we have the media, the medical system, the legal system, education, religion, economics. The family is also included as an institution that really upholds this idea, that puts into policies and rules and laws, is telling what the story that the ideological has told us is what is true, right? So for example, when thinking about a legal process, children are not often seen as credible witnesses, right? So their participation in the legal system might look differently if we had a different idea. let alone the fact that we don't want to traumatize our children in the legal process, right? Back to that hypersexualization aspect, the media hypersexualizes girls, and particularly those of color. And you know, in the news, we hear them called underage women. So that tells us a little bit about those ideologies that we have, again, of children being little adults, right? We have the interpersonal, where it's the way that we play out violence on each other, and it's based on that oppression, right? So it might be the way that we interact with children as adults, or the way that we interact with survivors, we may not take them seriously because of some of these ideas that we've been told, that we're swimming in this system, right? That then we start to play them out against others. And the internalized oppression factor is how we then internalize those ideas, the ideological ideas particularly, but even institutional and interpersonal, what other people are telling us about ourselves and our membership in a particular identity group. We start to believe those, and we start to act within those. And potentially we might say, I am not like that person. I am not like my group, right? So I'm different. That's part of internalized oppression. When it comes to children or survivors, right, it might be particularly for children, well, I'm not going to say anything because nobody's going to believe me anyway, right? And Anne will talk about this a little bit more in just a sec. But those are essentially the 4 eyes of oppression, how they work with each other. It's almost like a chicken and the egg situation. Which one comes first? Although internalized probably never comes first. But with those other 3, the interpersonal, institutional, and the ideological, you know, they all just reinforce each other, and that's why it really makes it difficult to target. But it's reassuring to know that if we target one of them, that's always a great place to start, whichever one of them. So, and I'll turn it over to Anne.
Thank you. And so keeping in mind those 4 eyes that Maria was just discussing, one of the interesting things to keep in mind is thinking about how long we've been talking about child sexual abuse as a type of abuse. And so we have these hidden truths here that we really have only been talking about this for a very short period of time. We have Kemp, who came out with Battered Child Syndrome. That was really around physical abuse and identifying physical abuse as a thing, as a syndrome. There was not a discussion around child sexual abuse. We have pieces that come out throughout the 80s, certainly Marilyn Vanderburg and what she did and how she came out and how she brought the light to that this was something that could happen in anyone's home, made a huge impact. It certainly made a huge impact as she is local to Colorado. So that was a big piece that happened locally and then moved into a national movement. But really a lot of the conversations around child sexual abuse have not come out until really the early 2000s. So really in the last 10 to 15 to 20 years, have we started to have these much broader and global conversations around child sexual abuse being pervasive, being anywhere, that it's not just related to someone who is lower socioeconomic or, you know, lives in a certain city. However, when we start to look at it now, kind of through this lens of this health equity and all of these additional pieces that have come around with oppression, we do see, and we start to look and see that there are groups, marginalized groups, who may be more impacted because of the oppression that they have received in other areas. And so on the next slide, one of the things that I want to talk about really is kind of that, who is targeted through child sexual abuse, through that oppression. So thinking about those vulnerable populations, who is accessible, who is lacking in credibility. And oftentimes children are incredibly vulnerable. They're easily accessible, whether in person or certainly online now, where we have children spending a great deal of time online. And when we think about children lacking credibility, that whole little person, like, well, they're little adults, but they don't quite have the mind of adults, and so we don't quite believe them in the same way, because maybe they're just making things up because they're just super creative little adults. But thinking about children, and maybe perhaps when I say children, we're thinking about white children. When we think about children who are coming from other areas or other nationalities or races other than those ones that we find in white cisgender families and communities, that we have that additional level of oppression that is lending to those children continuing to be perceived as folks who are more vulnerable, are more accessible, and continue to lack in credibility, adding that oppression piece to it. When we look at statistics on the next slide, we see that we've got, kind of depending on statistics and where you pull them, we've went ahead and sourced this. So if you wanted to be able to go back and look through that, you'll be able to pull that out again. But really looked at more than 1 in 4 girls first sexual intercourse was physically forced or coerced by the age of 18. When we think about girls and boys, sometimes there's a statistic around 1 in 10 children have been abused by the time that they are 18. But we know that this is a statistic that is big. It is getting more, there's more knowledge around child sexual abuse being something that is happening at a greater scale, but we're still not at that point where there is a, this could happen in my home, this could happen in my community, this could happen with the kids that my children play with. There's still that sense of, well, this happens somewhere else to other people. And that really is, when we look at these statistics, this is something that is happening at a much broader rate than is oftentimes realized. And of course, I'm speaking to a choir here at this group, where this is not something that is unknown to, I'm sure, most of you on this call, but understanding that those of us who work outside of this realm, this statistic may be unknown to them. And I did want to throw in just some statistics around Colorado and what we're seeing around Colorado. That in the last 5 years, we've had about 286 allegations of child maltreatment in Colorado. And of those, about 7% included concerns around child sexual abuse. 28% of those concerned involved male children, and 72% of those concerned involved female children. And there's certainly, I'll give you a link at the end if you wanted to do some more research on what's happening in Colorado. The slide that I see that we've moved to next around boys is that I wanted to ensure that we are continuing to talk about boys and men as we talk about child sexual abuse. That oftentimes the statistic that there is that 1 in 4 women, that 1 in 4 women, that 1 in 4 women. We know, and again, preaching to the choir here, but something to be thoughtful about in conversations that you're having with other folks, is that we know that boys are sexually abused. And we know that conversations from parents and caregivers to girls and to boys around safety looks very different. And that conversation can look very different from a white household to a Black household to a Latinx household. But thinking through that, oftentimes the conversations around girls really around making sure you're going to the bathroom with your friends, making sure that you know how to hold your keys when you walk to the car, making sure that you're doing this, making sure that you're doing that, making sure that your clothes look a certain way. In white households, that conversation with boys may be, don't get in trouble. In a Black household, that conversation with a boy may be around, be careful while you're walking, be careful about your hoodie, make sure that you are looking people in the eye or not looking them in the eye, or making sure that when you're dealing with police, you're looking this way and doing that kinds of things. But conversations around sexuality and potentials of being abused sexually aren't necessarily happening with boys in the same ways that they're having with girls, regardless of what that culture is. And so ensuring that as we're having conversations with children, whether they're boys or girls, regardless of what gender we're looking at, that we're having those same types of conversations around safety, regardless of what gender the child is. And so as we move into the next slide, We have a couple of pieces that are listed here around why children don't tell. And so we've put those up in lieu of time. We have those listed there. And I'm really curious, we've got, oh, if we could go back one more slide. We do have a little bit of time, and so I'm curious if folks have some additional pieces there or some thoughts that they would like to put, and I apologize if I appear like I'm looking this way, my chat box is on my second screen. And so we do have a little bit of time if folks wanted to put in the chat box, what are some of the reasons that they feel like children don't tell? Why children aren't telling about child sexual abuse? We know that we have a lot of dynamics, including any age or into adulthood, about not telling. They don't know that they've experienced abuse. They don't know that it was taking place. Language being a barrier. Nope, I can see the chat. Yep, so language being a barrier. Survivors don't want to expose their family. I'm just going to scroll back up and make sure I didn't miss a couple there. Yeah, as we discussed a couple of slides ago, children are vulnerable. Children are accessible. People don't often believe children. Fear is a huge component around this. And so when we think about education, we think about prevention, we at Illuminate strongly believe that it's an adult's responsibility to protect children, and that we want to give children the language that they need. We want to give children safe understanding of their bodies and make sure that we are using correct terminology, but understanding that as an adult, it's our responsibility to be able to provide those safe spaces for children, to be able to have conversations with others to ensure their safety, because that reliance that children will tell us that something is wrong, one, the abuse has already happened by the time the child has something to tell us, and two, for all of these reasons and all of the wonderful reasons that you all have put in the chat box, retribution, get in trouble. Yeah, that one getting that in trouble, especially when we think about boys and why boys oftentimes may not report is, I was told to go out and not get in trouble, and I feel like this is trouble, and so I'm not going to tell anyone. And so we can't rely on children, nor should we rely on children to tell us what has happened to them. Thank you, everybody, for putting all of those in the chat box. We can go ahead and, yeah. So when we think about the impacts of not only child sexual abuse, but oppression on survivors, we have the stigma and lack of awareness of CSA as a trauma as an adult issue. So we're not necessarily dealing with it as children, or perhaps not until adulthood, kind of being able to see that it is something to be able to work through. When we don't have access to resources or an understanding that this is something that we can heal from if we have the right resources, if we have the right supports. But if you don't have that in your community or don't know that that's available, there's certainly negative outcomes out of that. Fear, guilt, and shame, those are things that certainly survivors of all different kinds feel out of that. And that hypervigilance, so when we talked about some of those health equity pieces, that hypervigilance is essentially living in that state of awareness. And so oftentimes it can lead to heart issues, it can lead to high blood pressure, because the body just doesn't relax. So it's constantly looking out for the next thing. And that's a learned behavior. And it is a learned behavior that was very protective at one point in time, but as time goes on, it certainly impacts people's health. Systemic and individual bias and stereotypes are certainly impacts there, as well as lack of support from people that come from their community. So especially if you have, or someone has experienced abuse within a church or their school or their sporting event or their family or that place that was their community, it can oftentimes feel really difficult to feel support from a place where that abuse was coming from. Jenny, was there anything you wanted to add to that slide?
I don't think so, just that we've been measuring that here in Colorado through a needs assessment with the School of Public Health. And we have the data to really show from the adult survivor's perspective, when they're reaching out for help, they're not getting what they need. And again, that's part of why we do this presentation and open up this conversation, is that there's a lot more we need to do to change that.
Oh, wonderful. And I think we can go on to the next slide with the cats. So as professionals and providers and advocates, we are not in that space within a vacuum. We bring in our own histories, we bring in our own biases. I saw a comment from Dustin earlier on around some of the protective self-protection that folks may have learned as a coping mechanism. Those are all pieces that we bring into those professional spaces, and oftentimes those may negatively impact the folks that we're working with, especially if we're bringing in some of those pieces around bias, around assumptions of how someone may, should or shouldn't deal with something based on how they did or didn't deal with something. But that stress and the isolation, all of those pieces come into play to impact survivors in a way that both they can be the oppressor and they can be oppressed. And so I want to sit there for a second and think about that as we go into those spaces of professionalism, as we are working with folks who may be survivors at some level, or family members or caregivers, to understand that our histories, what we're bringing into that, will impact those conversations, those situations, and how it is that those families that we're working with come out of that conversation. And so being super aware of where we are in our own spaces and ensuring that that is not something that we are then putting on to other families or other caregivers. And Maria, I don't know if there's anything else that you wanted to add to that one, as this is certainly relates to a lot of what you were talking to before. I don't want to move on without giving you space to add anything to that.
I think you did really well, Anne. Nothing to add.
All right, well, Jenny, I'm going to pass off this next slide to you then.
Thanks, Anne. And because this section was the most directly related to childhood sexual abuse and adult survivor issues, and many of us have lived experience, I want to invite us all to take a collective breath, because I need one. Again, reminding ourselves that resilience is our capacity for change. And I love this quote by Pema Chodron. She says, "We don't set out to save the world. We set out to wonder how other people are doing and to reflect on how our actions affect other people's hearts." Just starting to be aware and curious about that simple premise, I think, is a place to start. And so that we can be aware of sometimes when our actions maybe have unintended consequences that we didn't even realize, and just to make space for that and to know that that's a starting point and we can move beyond that, is a place where we can be compassionate for ourselves. And again, just visually, one way to do that for me, I encounter this slide, and when we think about what are the barriers that we might be experiencing then, or that, again, children or adult survivors might be experiencing, this is to remind you that people need access to healthy food. Someone brought up, I think, the reality of food deserts, and that some families don't have access to fresh fruits and vegetables, and that's a real problem. And if we don't have safe housing, then that's an incredible barrier to anyone in terms of just maintaining daily life. But certainly having a safe environment from which to just ground and be safe. It's really hard to do trauma work and recovery if you're, again, in that survival fight or flight mode constantly. I would say it's probably impossible to really engage in holistic healing if we don't have access to services. Sorry, just want to make it really clear that these systems that we've talked about are creating the trauma, and they're preventing people from getting access to healing services. We've got to see that to change it.
Yeah, and with that being said, where do we go from here, right? There's a lot to do in order to be able to do that, and that really stems from, or we need to start from, this anti-oppression lens and this anti-oppression work for all the reasons that we have all been mentioning this afternoon, right? So challenging the existing center as opposed to inclusivity or diversity, or oftentimes we hear, like the DEI work, which is great, and also making sure that that work is anti-oppressive, right? Because we don't want to just bring people to the table when we're not ready for them, when that system is built up, like we talked about earlier, to marginalize, right? So making sure that we're changing what we mean by centering and using these social justice-based philosophies, right? Health equity work is inherently anti-oppressive. And it may not include everyone. That might feel a little uncomfortable, right? To think that some of this work might not include our specific identity, but that's okay, because if we focus on the most marginalized and we center those, that's going to end up impacting us in whatever identity we hold. It's like universal design, if you all have heard of it, right? Universal design in the sense that if we focus on the most marginalized, we center the groups that might need some more of the supports, that's going to, that other people are going to benefit from that as well, right? So it's okay that it may not include everyone. We want to provide systemic and structural change, as we've been talking about, focus on root causes, and then also work from that historical context that we didn't have a lot of time to go into, but we encourage you all to do a little bit more of that research, the way that Jenny talked about that. Learning about those boarding schools and the impact of that, learning about how slavery is impacting the world we live in today, and knowing how, again, that impacts what we do today. So going on to the next slide, what would these 4 I's, the ideological, institutional, interpersonal, and internalized, what would those look like if we flip that on their head, right? If it's an empowerment and resilience instead. So this ideological aspect where we are believing, supporting, empowering survivors, whether they're children, whether they're CSA survivors as adults, whether they're survivors as adults, right? That we are believing, supporting, and empowering. Also institutional, so creating, again, those universal designs for those equitable systems where we don't have those food deserts, where all of our schools are funded similarly so that there is equal access to educate, or equitable access to education, thinking about restorative justice practices and being able to credit the work that is being done around restorative justice to a lot of these marginalized groups. Like I mentioned earlier, as long as there has been oppression, there have been those groups that have been doing restorative justice work that haven't been talked about or been mainstream, if you will. And then the next one is interpersonal, right? We are redefining and relabeling what we have come to know as allyship for this interpersonal aspect of it. Allyship is no longer enough, right? Because allyship determines or denotes this idea that I am not affected by these systems, so I'm gonna stand with you in order to break down those systems so that you're not affected by them. No. These systems impact us all, and we must be co-conspirators, we must be accomplices, right? If you go down, I'm going down because this system impacts me too, and if we change it to benefit you, it's going to trickle back to me, right? So this quote is really powerful of, if you've come here to help me, you're wasting your time. But if you have come because your liberation is bound up with mine, then let's work together. And that's really important, right? And at this point, I'll turn it over to Jenny to talk to us about the internalized vision.
Yeah, I just wanted to think about, for those who are adults now who experienced sexual abuses in childhood, some themes that have come up during the month, during our awareness month, when we've spoken with survivors, and certainly through our work at Wings, we hear all the time, there's such an internalized sense of worthlessness, and a belief that that will never change. And certainly we know that healing is possible, and that we can heal, that we have an inherent wholeness and goodness that we really never lose. We're just invited to rediscover and reclaim and restore when we can prioritize healing. And these things are interconnected. And I just want to name that these are maybe some statements that survivors, you know, might want to try on if that feels meaningful, and or there might be statements that would come up for you that feel really empowering and resilient, if you've been directly impacted. So just wanted to put that idea out there.
Yeah, and I just want to call out this comment that Rebecca made in the chat box of many of the healing services, in quotes, are traumatizing in and of themselves, where services are transactional and traumatizing, and community and connection beyond services can heal. And just a lot of support around that in the chat box in response to you, Rebecca. And that's essentially what this image is, right? Moving away from this very transactional thing. I really love how you put that, into kind of this holistic picture, this holistic view of a whole individual, and using these trauma-informed principles from SAMHSA, the Substance Abuse and Mental Health Services Administration, where we understand trauma, we understand the historical aspect of it. We understand cultural humility, we understand collaboration and empowerment, right? Where it's not just, here are the services I can provide to you, and I'm essentially, you know, not, as a provider, not gonna be connecting with you in the same way because of these restrictions that we have, but we're collaborating, right? We're collaborating what it is that you need. We're collaborating with the entire community to shift all of those 4 eyes. So that's essentially what we want you all to take overall, but particularly from this image.
Thanks, Maria. And I know we're so short on time, but there's been a lot of conversation in the last several weeks by survivor voices. And we've been listening, and we've been inspired by a lot of what we're hearing. And this is someone who is a survivor, Tabitha Mamparia. I apologize if I'm mispronouncing that. She was a speaker on the National Survivors Agenda call with several other partners. And that was the first time I learned about her and her TED Talk, which is called Trauma Not Transformed is Trauma Transferred. And I would really encourage you all to check that out. It was actually on the Survivors Agenda call where she talked about the statement from her community, and I believe she is from Uganda, this idea of community and connection that's been raised, that really our community isn't whole if one person is not whole. And I just thought that was a beautiful reminder that we all should be thinking about in reimagining this world that we've been talking about. So here's the link. I would encourage you to watch that. And on that point, this was the image that was shared. I don't know if many of you might have been on that call as well. It was great that they provided this visual representation of some of the themes that survivors shared in the chat line that they did. And we just thought this is a beautiful representation to again, reimagine that connection and community. So I would encourage you to check out Survivors Agenda for sure. And this is a quote that I was just thinking about, you know, again, for those who've experienced direct abuse via childhood sexual abuse or other types of abuse, you know, that real experience of being used as an object. I mean, really, we can learn to relate to people that way or to ourselves that way. And I think for so much of mainstream culture, especially, I felt like this quote really speaks to a shift that we need to open ourselves up to, that we really need to love people and use things instead of using people and loving things. And it's such a small, basic idea. And I think a lot of folks really could benefit from that.
Great, so we wanna make sure that we end on a place of what can we do next, right? We've talked about a lot of heavy things, as Jenny has been mentioning throughout, or calling it out. And so we wanted to do some takeaways, right? So continue learning. And we've mentioned this a few times. We condensed this conversation from a 4-hour training to a 1.5-ish training. And so there's a lot to learn, right? This could be semesters of study. This could be, there's just a lot of information. So please do continue learning. There are additional resources on anti-racism and anti-oppression work, as well as on CSA trauma and the way it impacts adults. There's a resource page from that Jenny put together based on our work on this presentation at the link that Julia just posted into the chat box. Please do use that to dive a little bit deeper into some of the concepts we've been talking with you all today about. Question your assumptions in social conditioning, right? Learn to understand your social location. That's why we started this conversation with that, because that really does impact what lens we look at the world through, how we're providing service, right? How we are in community with people. So it's important to know where your social location is and know where the people you're working with, where their social location is as well. Interrupt oppression at all eyes of oppression when you can, right? So whether that's at an interpersonal level, if you see somebody at a grocery store who is saying something that is objectifying someone or telling them to, based on their racial identity or ethnic identity, interrupt that as you feel comfortable, right? And practice ways to do that. Think about media and what impact, who you can write to, or what your dollars are supporting to be able to interrupt that oppression at all levels. Be part of transforming systems that oppress, exploit, objectify, or abuse others, whether that's in your line of work, whether again, that's in your day-to-day life, whether that's calling your legislators, very different ways, and all valid and all needed to be able to be part of transforming those systems. And think about other ways that you can impact oppression and interrupt in different ways, right? Rebecca shares with us in the chat box, just beginnings for kind of a resource. So thanks for sharing that, Rebecca. And feel free to, in the chat as we're closing up, to put more resources that you all have or other things that, that you all have done or want to do to interrupt oppression. So, and Wings will share a little bit about what they're doing to interrupt.
Yeah, I mentioned earlier that we've been collecting public health data to try to really amplify the voices of adult survivors of childhood sexual abuse here in Colorado so that we can help their needs be seen in order to change systems. We've started that work and it's continuing. So we have some assessments coming up specifically for survivors within the Latinx community and other survivors of color. So please stay tuned for that. And this is our month-long race for healing. And so we did want to invite anyone that might be interested in participating in that to sign up. This is featuring different sessions on learning about this issue and an invitation to try different aspects of healing, like nutrition, embodiment, meditation, that can help with the healing process. And as Melissa said at the beginning, also might be helpful in navigating COVID because what's good for the mind, body, and spirit is really good at the human level. And someone had said as a question, is the opposite of being oppressed, freedom, liberation, and justice? And I think those are great ideas. And, how do we rethink what that looks like in the world? And if we really pay attention to what's going on with everyone's mind, body, spirit, like their wellness, then what does that look like in terms of thinking about how their life could support that? So I guess I would just say, I think these are great goals. And I think there's just so much more in terms of what that could look like in fostering, flourishing and well-being as the baseline, not, again, abuse, oppression, and trauma that comes from that.
All right, so I know that we're right here at time, but I wanted to let folks know about some current free training that's happening right now, really around the prevention of child sexual abuse, and also recognizing and responding to abuse as well. And so at Illuminate, we created a website, and I went ahead and put it in the chat box around the tipping point. And so this understanding that when we have a certain amount of folks who have education and knowledge around a certain topic, that then starts to flow out into the community, and we have actual behavior change that comes to a point there. And so on the site, there's a little bit more information around kind of child sexual abuse statistics in Colorado, more about this movement itself, but most importantly, we are providing free trainings throughout the next several months, and we'll be doing at least one a week, if not more than one a week, and at least 2 Spanish presentations a month as well, of the Darkness to Light Stewards of Children training. And so we have facilitators across the state, as well as within Illuminate, who are providing those trainings for free. So go check out that website. If you were interested in having and those are all virtual and again free, if you're interested in having a training around child sexual abuse prevention, as well as recognizing and responding, let me know. I'm sure you can get in touch with Jenny or someone to get my information, and we can also provide those trainings directly to, like, if you have a group of people or professionals that are interested in having those trainings as well. So we're open and able to do those in a variety of different ways, again, at no charge, which is the piece I want people to hear. So free training out there around prevention, because as we think about this in a cycle, we want to ensure that we're putting pieces in place to stop that.
Great. And CCASA, we want you all to use us as a resource as well. So we do have more opportunities to learn, particularly around anti-oppression, and also how we can link anti-oppression to the sexual violence field specifically. So our training is free for members. We do have paid training opportunities available for non-members. So you can also, Julia, thank you for putting our website into the chat box. I'm also going to put in our training request form into the chat box. So if you're interested in anti-oppression trainings, you can do that through there as well. And technical assistance. So maybe you don't need an entire training, but you're working through how to incorporate some of these concepts into the work that you're doing day to day. We're also happy to provide some of that support, particularly for members, like I mentioned, but some of the other work we can talk about how that might look for non-members. We also provide public policy advocacy. So we have who formerly was the director of policy, title just changed, I think is now director of public relations, who does a lot of work in the Capitol and takes a lot of these concerns that you might have so that these laws can be changed, right? That impact this anti-oppression work and sexual violence work as a whole. So we also have some free training opportunities, webinars. I'm going to put our events calendar in the chat box as well, where you can watch some of those some of those trainings and request trainings as well, as far as webinars are concerned, and those are always free to folks. So yeah, we're here. Please reach out to us. We're happy to help.
And just on the question slide, if we could, those are our email addresses, thank you. But on the question slide, I know we're over time. Certainly want to invite anyone that needs to leave to go ahead and do that. I think our panelists may be willing to stay on for a few more minutes if folks want to stay in and provide those, or you can email us at any of these for an email answer. But any final comments before we sort of let folks go that want to go?
Yeah, just thank you for being here, on us and having this conversation and sitting here with what might have been uncomfortable. And hopefully it was slightly uncomfortable, because that means that we're growing and we're learning. So I just want to thank you all for being here, for this interactive chat that has been happening. And I want to thank Wings, and I want to thank Illuminate for the invitation and for partnering on this.
Yes, Jenny, thank you so much for including us.
Oh my gosh, well, thank you all so much. And one quick question I saw in the chat that I wanted to answer. Someone asked if any of our organizations have internship opportunities. We do, and we're adding a few more, so watch our website for that.
Yeah, CICASA has some limited opportunities for internship, particularly around the policy work. And so reach out generally before the legislative session starts. That's generally where that happens, but they're limited, of course.
Gotcha. Okay. Well, I guess, let's see. I guess I'm trying to determine if we're going to extend this for those that want to stay, or do we want to wrap up and...
Yeah, it sounds like we're wrapping up, Jenny. Certainly, if you missed any of those emails, or if you want a copy of the presentation, do contact us at wings@wingsfound.org. We can connect you with whoever or whatever it is you're looking for. Thank you all, Maria, Jenny, Anne, for joining us tonight and being part of this really valuable content for the folks who are watching now and who will watch the videos in the future. For those of you who took some time out of your afternoon, evening today, thank you so much for being here and for spending some of your time with this really important set of topics. Our intention in sharing this information with you has been to provide ways that you can stand with CSA survivors by engaging in activities to learn about CSA, understand more about the healing and prevention process, and to engage in activities that promote the mind-body-spirit connection to help build your own individual resilience and our collective resilience in the world. Together, we are creating a world where survivors of childhood sexual abuse can be seen, heard, honored, and supported. And we honor you and thank you for joining us in this discussion, and hope that you, if you haven't already, will choose to join us in the Race for Healing this month. As we mentioned earlier, it's not too late to sign up. Sign up today and you can have access to everything we've done so far, plus what we have coming up. Our next event will be It's About Presence with Nate Ewart this Thursday at 6:30 p.m. Mountain Time for an exploration of mindfulness exercises that will cultivate presence and awareness through grounding and centering. In the meantime, check out that resource page that we shared with you for other ideas for learning and healing that you can be doing. Remember, if you are part of the Race for Healing, all of your minutes count toward our goal of 150,000. As of today, we are just over 40,000, so we are getting there. Thank you again for being here. Email us at wings@wingsfound.org if you have any questions or need any assistance, and have a wonderful rest of your day.
Thank you all.